This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
We are excited to welcome Dr. Dladla here to our show. She's the founder of Gramercy Park Integrative, yes, based out of New York City. And she's here helping so many people in so many different ways. So first and foremost, I want to welcome you here and please say hello to everyone to begin.
Hi, thank you so much. Thank you so much for having me.
Great. Well, please introduce yourself and, of course, your business. Tell us a little bit about what you do.
Sure. So, my name is Dr. Dladla, and I have a integrative medical practice in Gramercy Park in New York City. We've been here for a year and a half. Our practice basically focuses on an integrative and holistic approach. We use the framework of bioregulatory medicine,
Mm-hmm.
which basically suggests that the body has its own innate, power to heal.
Mm-hmm.
And our role is to enhance that healing process, to remove some of the obstacles to that healing process.
Beautiful. I love this because it's the both the best worlds, right? Conventional medicine, but there's also
Exactly.
more of the holistic side of things, and both clearly are doing very well. And I want to get to the pillars of your approach, and of course, learn more in detail. The types of services you're providing, especially with gut health, weight loss, hormone therapy, and so much more. But first, I'd like to kind of get to know you on a personal level to find out where you're from. Tell us your background. I want to know about your journey in school and how you decided to become a doctor, then let alone go into the integrative healing type side.
Yes. So I was raised in Brooklyn, New York.
Beautiful.
Um, I basically went to school having no background or interest in medicine. I actually majored in comparative mysticism.
Wow.
So yeah, this is a very unexpected and unusual major, but it really intrigued me because it really looked at kind of the unity between varieties of cultures, religions, philosophies. And I was really on this trajectory to abandon the world and go and become, a mystic in the mountains.
Wow.
So that was my plan. If I wasn't going to be doing that, I was going to be teaching
Mm-hmm.
comparative mysticism. However, kind of during that journey, I had I guess, an epiphany or a shift. And I really was really inspired to go towards medicine as a way to actually cultivate this self-knowledge and this self-realization,
Wow.
and a way also to provide service.
Well, I read that you graduated college and then you had to go back because you didn't take any science courses, right? I mean,
Exactly. Yes, yes. So it was actually my last year when I discovered this, right? And then I had to go back and kind of start from scratch and do all the science requirements, the research in 2.5 years.
wow.
And I'm thankful that I had family and friends really supporting that, but I really was inspired to make that move, and it was also unexpected.
Amazing. So then you ended up at Cornell Medical School, correct? And tell me
Yes.
the type of medicine that you have been in for so many years and tell me
Oh
what
yeah.
happened.
So
Yeah.
yeah, so I've been an internist for over 20 years, and it was really the past, I guess, 5 or 6 years that I really got interested in integrative medicine. I had worked in a variety of roles and, doing internal medicine, operation, and I basically figured that, I can help people to a certain extent.
Mm-hmm.
But when you want to focus on things like prevention, wellness, longevity, those things are really not kind of allotted in the framework that was kind of given to us. So this is really what motivated me to kind of go out on my own and start this practice, middle-aged.
Amazing. This is beautiful work. And I'm so excited to talk more about the types of services you're offering and to talk about some of the patients you're helping. I mean, there's so much when it comes to, this integrative health in a sense. And I would love to get started to talk about specifically some of the work you're doing with integrative health, whether it's the medical weight loss section. Do you want to start there? Anti-aging? I mean, you do so much. So let me ask you, where would you like to start?
Yeah, so I would say that kind of everything is under that framework of the bioregulatory medicine model, but our focus really is longevity, vitality.
Okay.
We want to increase, lifespan, but also health span. And from that kind of center point of longevity, there are many things that branch out from that. So one is our work with bioidentical hormones. So we see that hormonal balance is really critical, right, to creating this equilibrium and regulation in the body. And we focus on things like pellets, we do injections, creams, and we work with men and women. And we find that working with bioidentical hormones, people really have a significantly improved quality of life. And it also increases their lifespan. So that's one of our very rewarding practices that we do. Um, in conjunction with that, we also focus on weight optimization. So everything is kind of customized to that particular person. And we do like to integrate hormonal therapies as well as weight loss therapies. And, the idea is to really create this very strong foundation with, exercise, diet, stress control. All of these things are kind of really like the scaffolding to really
Yeah.
create this like trajectory of health.
Got it. I know we have like your pillars of approach, for example, the hormonal symphony, as you kind of just mentioned the bioidentical hormones and pellet therapy. I would like to get just, a little more details about what that is. Some people hear about this hormone replacement therapy, they don't really understand it. Could you
Mhm.
share just a little bit of that?
Sure. So we use bioidentical hormones, and those hormones are plant-based, and they mimic the body's natural
Oh,
production of hormones.
got it.
So
Okay.
when we use pellets, the great thing about pellets is that you can space out the treatment. So we can insert the pellet into the patient, and they can do this every 3 to 4 months, sometimes longer if they are feeling, the positive effects. And this really kind of sustains and balances their hormone level.
Where do we inject the pellets?
Oh, right in the butt.
Awesome. Awesome. I didn't know. And there's probably other people out there who are not familiar with this either. I'm learning
Yeah.
too.
Yeah, it's
Wow.
a very quick and simple procedure. We inject that pellet right into the fat of the
Okay.
buttock and takes about like 5-10 minutes. It's pain-free because we numb the area and people go home and they start feeling the effects within a day or two, and they have really minimal reactions or side effects.
Wow. Okay.
Yeah.
I never heard of pellet therapy. I've heard of hormonal replacement therapy, but not
Yes.
this. This is
Yes.
fascinating.
But we're flexible. So for people who are not ready for that, we do prescribe creams, hormonal
Yeah.
creams or injections, but many people prefer the pellet because it's just, you don't have to think about it. After those few months, you're good. You come back, we repeat the process. We check your blood work, we see how you're responding, and then we take it from there. So
Beautiful.
it's a customized approach.
And what about the peptide therapy? I was reading a little bit of that. That's going to help with our cellular repair.
Yeah, so a lot of the kind of, I guess, the principles or foundations for longevity is that cellular regeneration. And if we want to kind of help stimulate the body's own ability to heal, we use natural peptide therapies, and we can use them for a variety of reasons. Many people have these very non-specific symptoms such as fatigue or just malaise, and when they do blood work in the traditional setting, they don't see anything that's wrong. However, when we start optimizing with nutraceuticals, with peptides, with hormonal therapy, with what you see that all of these things start to come back into balance. So that really is our objective to kind of get also to the root cause of what are producing these symptoms before we get to the point of someone having a chronic disease. And if they do have a chronic disease, our goal is to try to reduce the negative impact of that disease and ideally reverse or slow it down.
Amazing, amazing. All right, what else is part of our pillar list that you wanted to discuss?
Um, so we also work with red light therapy,
Okay.
because the light therapy is something that also directly impacts the cells. And we find that, having a multi kind of dimensional or multifaceted approach is very effective. We want to do things to kind of help to calm the nervous system. Many of us are in constant fight or flight.
Mm-hmm.
We are in sympathetic overdrive. We're in this
Yes.
chronic stress. So the light therapy, as well as other things that we do, try to get the body back into the parasympathetic space where we can heal, where we can actually rest, where we can digest our food properly. So this is something that we emphasize through talking about stress reduction techniques, and there's so many different ways to approach stress. And the reality is we're all going to have stress. So really, it's about how the body can create this resilience to stress, how the
Wow.
body is responding to it, and how they can manage it and also and benefit from it.
Well, and can I just ask about the red light therapy? How does that work? Is
Mhm.
this for our body, our face? Where do we
Yes.
put this red light therapy? Is it on certain areas of the body?
Yeah, so we have different modalities. So one is called the Origin, and it's a helmet. So this is really good for people who are having memory issues, who are feeling anxiety, depression, all of these symptoms. And they basically lay down with a helmet, relax, maybe fall asleep. We do it for 20 to 30 minutes, and people see a very, very positive result. And we do, several. You would do one, per week if possible for a period of time, and then you truly see the effects. For our bigger machine, it's for pain, just for general body inflammation. We lay the patient down and we put the red light wherever that pain is.
Ah,
And if there's not a particular area of pain, but just for general, to decrease general inflammation, we put it on the chest area and we just let the person relax, rest, and soak it in. Yeah,
beautiful. Thank you for
yeah,
explaining that. Wow. Okay.
absolutely.
Still, I mean, I hope we have more shows because there's really a lot to talk about with all the services. I was even reading before you're helping people with their bodies, whether it's like osteoporosis, heart disease, diabetes, even,
Yes.
allergies. I mean, there's a lot that you do here. Chinese medicine, even, right?
Yes, so we definitely we offer nutraceuticals, we Chinese herbs when appropriate. I'm working with a wonderful acupuncturist who also will provide those services. So it's very comprehensive, and also happy to say that someone joined our team who is a Reiki master. So
Ah,
she's also doing a lot of energy work on patients who are interested, and that also kind of adds to the fullness of what we're able to offer.
wow. And also, I was reading, there's a lot we're going to talk more about gut health, and we keep hearing gut
Yes.
health, gut health. What happens? Because people talk about it, you hear, and no one I don't think really understands it. And this is like you're an expert in this as well. Did you want to kind of talk about this gut immune brain access and what this whole thing is about? And people say, I have leaky gut, or I have, tell us what's going on in the
Yeah.
world and how important gut health really is and what you've all discovered, in your field.
So I think that gut health is really, again, one of the fundamental or foundational places to start. Many of us do have, unfortunately, leaky gut. And what we find is when those junctions of the gut open up, the toxins are released into the bloodstream.
Mm-hmm.
And this can
Wow.
create a foundation for many, many different diseases, even
Wow.
cardiovascular. So working to repair the gut is like an essential part of any kind of health health plan.
Yeah.
It is very, very common for people to have leaky gut because we are exposed to so many toxins. Even if we are eating well or exercising, just our lifestyle, the stress that we have in our lives, that can also create an environment for leaky gut to occur. We find that a lot of the immune cells, right, they're lining the gut. So
Mm-hmm.
when we start to restore gut health, the immune system improves. There's this connection, this signaling, as you mentioned, between the gut and the brain and the moods. So once we work on the gut, we improve the ratio of the good bacteria.
Mm-hmm.
We see that even certain mood disorders improve, anxiety, depression, those things improve. So, with whatever condition that we're working on, starting with the gut, analyzing the microbiome, understanding what underlying pathogens, bacteria are creating this like low level inflammation, that's really where we start. And the interesting thing about gut health is that, you don't have to have gut symptoms to have an imbalanced gut. So a lot of it is doing this kind of foundational detective work, figuring out what those underlying issues are, and then addressing them, and then working our program from there.
Beautiful. Oh my goodness. And by the way, let's just remind everyone who we're talking to. Excited to have her here. The founder, the owner, our doctor friend from the Gramercy Park Integrative here in New York City. And by the way, are you treating patients in person in New York, or can people do virtual treatments as well?
They can do both.
Right.
We have a full service clinic here. We do blood work, the whole works. But we can also do virtual for people who want that convenience as well.
Perfect. All right. Dr. Dladla, thank you so much for
Yes.
being here. We still have plenty more time to chat and to talk more about the work that you're doing here. I mean, there's cardio prevention as well. I know that's something you wanted to mention for today, but again, at your own pace, please. Where did you want to go next?
Yeah, so with our cardio prevention program, this is something else I'm really excited about. This program is focused on the work of Bale and Donin. And the idea is to really aggressively address arterial health. And we look at arterial health in a very comprehensive way. So the idea is we want to prevent people from developing arterial disease, which unfortunately is one of the most common things that we develop. And we really we do a lot of investigations to see if there is any underlying arterial disease. And then we provide, really, it's an integrative approach. So we use nutraceuticals, again, stress reduction, things to activate the parasympathetic nervous system. But we also use medication, pharmaceutical medication, if warranted, if necessary. So this approach really, I think, is very, very effective in trying to prevent people who are at risk for developing cardiovascular disease or arterial disease. If they have developed it, our idea is we want to prevent someone from having an event.
Yes.
And an event is heart attack, stroke. And unfortunately, it's so common. And a lot of it is because people are not necessarily being diagnosed in a timely manner. They can go to their doctor, have their physical, everything is great, but then they can have something happen the minute they walk out the door. So our program it's a year-long program where we do a very intensive investigation and also
Wow.
diagnostics to see what is actually happening with
Mm-hmm.
with the arteries.
Wow.
So this is really, really exciting.
I think this is beautiful. I'm excited. By the way, just curious, do you live in New York City, or do you still live in the one of the
Yeah, so
five
I
boroughs?
I used to, but now I moved to Montclair, New Jersey, with my
Beautiful.
two husband and two kids. So
I didn't know if you
I
wanted to
mean,
share personal information. Okay, good, good,
oh
good. Because it wasn't in your notes, so sometimes I don't want people to talk about what they're most comfortable with. How old are your
yeah, yeah.
children?
Yes, so I have an 8-year-old and a 10-year-old.
Oh, I got
8 years
goosebumps. Me
and 10.
too. Wait, wait,
Really?
wait.
Oh my God.
Wait, did you say girls, boys? What did I?
Yeah, so the girl Amia, she's 8, and my son Dylan, he's 10.
Oh, I
Yes.
have two boys, Austin 10, Jackson 8. So we're really in the thick of it.
Nice.
I'm second and fourth grade. Is that what you are too? Or
Yes, exactly. Yes.
oh
Yes.
wow, I got goosebumps. How much work and dedication as a mother you put in, let alone here as a doctor, having your own practice like this. How do you do it?
Oh my God. Basically, I use my own treatments. I
Yeah.
use all the things that I'm recommending to kind of keep myself steady because it is a journey. It
God
definitely is a
bless.
journy. Um,
Wow, what an
but
amazing
I'm
role model,
thankful.
though, for
Yeah.
mom to be such a hard worker like this and do all this. I know it's not easy with children, my goodness. But that's well, end of year stuff happening now, right? Trying to get into the swing. And then what do they do for the summer? Do they do camp or
Exactly.
anything?
Oh,
Or
tons of camps. They got out early, so we're like, okay, what are we going to do now? I'm like, a little bit too early for my taste, but yeah, tons of camps. So
all right.
yeah.
Well, good luck with that.
Um,
I just want to ask a question since I have the expert here on the line. I've heard about something, again, I don't really have much knowledge about this, but it's called telomeres. Is it
mm.
true that we could test our body's telomeres and kind of will tell us our age? Can you share what that is and
Oh,
if that
yes,
has any
yes.
meaning? And can we really increase those telomeres by doing this type of integrative medicine?
Yes, so definitely there is a lot of like genetic and diagnostic testing that can actually look at your true age. So the telomeres are one of those modalities that we use in longevity medicine. And if we see that those telomeres are shortened or somehow impacted, we can start doing things again to restore the body's natural rhythm. That is through the peptides, red light therapy, therapies that work directly on the cells to regenerate, and then having those lifestyle pillars, diet, exercise, stress reduction. Those things are really kind of like the bedrock of everything. But we do that, and I work with a practitioner who does do genetic testing to look at the biological age, but also to see if there are any underlying risk factors for any chronic disease. So this is very, very useful in
Wow.
terms of how we kind of navigate treatments. So definitely using biomarkers, genetic testing, the physical exam, which a lot of people are not doing anymore, but the physical exam, those things are really critical in creating a customized plan for people.
Beautiful. And what else would you like to share for today, being it is our first show? We still got 3 minutes left. Yeah, this is amazing. I'm excited.
Well, I'm excited to be here. I'm excited to talk about the practice. We are welcoming new patients. We're really, really happy to serve. So, anyone who's interested in longevity, wellness, gut health, hormonal health, weight loss, we are here to serve.
Anti-aging, right? Come on, don't we want to look
Anti-aging,
better?
that's
There's,
right.
we could do the like Botox and the fillers, but why not hit it from the inside, right?
Exactly. Exactly.
Oh,
Exactly.
oh my goodness. And I want to ask, I know, obviously, I think a lot of people, I hear about weight loss, and of course the shots. I don't know the names of them, but
Yes.
is that something that
Yes.
you recommend in conjunction with the weight loss program? Or are you a believer in this? Just curious because
Yes, yes,
okay.
absolutely. Because the GLPs, the shots, they're very, very effective actually in decreasing inflammation.
Ah,
So they have amazing effects. I had patients who were on these medications just for weight loss, but then they found that their eczema improved, their allergies improved. So this really has wide-ranging effects. So I definitely recommend that in conjunction with other lifestyle, modalities. But this has been really revolutionary. And I think if we're talking and linking it to cardiovascular health, it also
mm-hmm.
has the ability to reduce the risk of cardiovascular outcomes. So this is really something that we
Nice.
do regularly, and
All right. And I just
people are
have one
very,
other
very happy to see
question.
results. Yeah.
If you don't mind, someone like myself, I'm 47, and I go to the gynecologist, they run the test, oh, you're fine. But I'm going to be going through menopause soon. And so many women experience so many changes with their hormones, with their bodies, but I feel regular medical doctors don't help us with this? Are you helping women around my age with hormonal treatments and therapy? Because I'm sure you know a lot more than my gynecologist. No offense, but I always say, shouldn't I be doing more? Shouldn't I? No, 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 you're fine. I mean, tell me the truth. Someone in this phase and stage, what could you benefit from as a female?
Yeah, so definitely this is our focus when we talk about hormonal balancing.
Yes.
I'm in that phase as well, and we definitely focus on hormonal, um, hormonal treatments because a lot of times when you start replenishing those hormones, people feel better, they
Yep.
have more energy, they look better, their whole quality of life changes. So I don't believe that we should just try to get by. I think we should try to focus on our vitality.
Yep.
And there are things that we could be doing in perimenopause and also in menopause to make the situation better and for andropause, men and women, because we
Beautiful.
both go through it.
All
So
right.
I'm a big proponent of that. So
Great. Just letting you know, you have amazing 5-star reviews on Google. Everyone is so kind at your practice. Excellent bedside manner. This person says it's comforting to be around so many female presenting medical professionals. Also, the knowledge-based, practical, comprehensive care. The doctor is a pleasure, and the front desk super high touch. This is 5-star care they're giving you, and I would love to hear next time we speak some more of your client testimonials as well. And for today, unfortunately, we are out of time, but I want to thank you for being here and a pleasure getting to know you and all that you have here for so many people, men and women out there.
yes, thank you so much. This was great.
Thank you. How can we contact you?
Yes, so you can contact me. Let me give you our number. It is 212
Mm-hmm.
970 9401.
Perfect.
And
And
you can, mhm.
the website,
Yes, our website,
GramercyParkIntegrative.com.
it's gramercyparkintegrative.com. Yes.
Beautiful. Thank you so much. Pleasure having you and looking forward to the next time we get to connect, okay?
Yes, thank you so much.
You're welcome. Enjoy the rest of the day and, of course, the weekend with the kids, too. We'll talk soon.
Yes, thank you.
Bye bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.